Good morning. Welcome to Japan. Today, I'd like to talk about a bee sting, especially when you should go to the hospital. When you get stung, there are some common symptoms that usually appear. If you notice symptoms that are different from these usual ones, that's when you should see a doctor. Normally, the pain around the sting area gets better after about a day. However, the swelling often becomes worse next day. This is quite common and usually not a cause of worry. But it's nice to keep an eye on it and see how your body reacts. After about 3 to 4 days, the swelling gradually goes down, and in most cases, it improves naturally without any treatment. But if the swelling or pain becomes worse again later on, you need to be careful. This could mean that bacteria have entered the wound and they're causing infection, which might require treatment. In that cases, you may need to take antibiotics. Please make sure to visit or consult a nearby clinic. Sometimes pus can build up inside the swollen area and an abscess may form. In such cases, oral medication alone may not be enough to treat it. You may need injections or medical procedures. For example, a doctor may need to insert a needle to drain the pus or makes a small incision to clean the inside and then remove the bacteria. Have you ever thought like this? If an infection can happen, maybe I should take antibiotics from the beginning. That sounds like a good idea, but taking antibiotics just for prevention is not recommended. Antibiotics can have side effects, and using them an infection isn't certain, can actually cause new problems. First, the good bacteria in your gut can die off, which might lead to inflammation or infection caused by bad bacteria and cause diarrhea and so on. Second, antibiotic resistance can develop, which makes further treatment harder. So it's really important to watch carefully for signs of infection and use antibiotics properly only when they are truly needed. Next, let me talk about emergency situations, cases where your whole body reacts and you may need to call an ambulance. Bee venom is a toxin that's harmful to our body. When you get stung, your immune cells rush to the area to fight against the venom. As they fight, the area becomes red, swollen, hot, and painful. That is what we call inflammation. The immune system remembers past enemies. So if it encounters the same one again, it reacts more strongly the next time. In this process, it produces antibodies. However, some antibodies can overreact. causing a very strong allergic response. That's why some people, when stung a second time, they can experience a severe allergic reaction. This is called anaphylaxis, and it can be life-threatening. Let's review the symptoms of anaphylaxis. You may have a swelling, redness, or itching of the skin, but what's more dangerous is when the eyes, lips, or mouth, the mucous membrane are affected. These membranes covers important organs inside the body. So if you see these symptoms, it could mean that inflammation is also happening inside of your body. If the mucous membrane in your airway cell, you may have a difficulty breathing. If those in your stomach or intestines swell, you may have a vomiting or diarrhea. This can cause a loss of body fluids, low blood pressure, and in severe cases, the heart may stop. These changes can happen within 15 to 30 minutes, a truly emergency situation. If you are stung in multiple places or symptoms are spread throughout your body, you must call an ambulance. For example, your whole body turns red. The eyes or lips are swelling. You have sneezing, coughing, or trouble breathing, or you experience abdominal pain, vomiting, or diarrhea. All of these are emergency signs. In these cases, call for help immediately and dial 119 for the ambulance. Lie down in a safe place. If your body blood pressure drops, you could faint. So lying down helps prevent head injuries and keeps blood flowing to the body, to the brain. It helps you stay conscious longer. If you need to use the restroom, always go with somebody. When you are weak, you could faint afterwards, even after urinating or passing stool. Gentlemen, please sit down to urinate. It's safer. After using the restroom, don't stand up right away. Stay seated for about 30 seconds. Check how you feel and then stand up slowly. By the way, have you ever called 119 before in Japan? In the next session, I'll explain how to call an ambulance in Japan and what to say when you needed help. I hope you all have a wonderful trip in Japan and please stay healthy and safe. Have a nice day and see you next weekend. Thank you.